All right, thanks for staying with us. As we come back, sadder news, if you like. This just in, 17 new confirmed cases of COVID-19 have now been announced by the Nigeria Center for Disease Control, the NCDC. The total confirmed cases now in Nigeria stand at 255. 44 people have been discharged. There have been 6 deaths. Of course, the breakdown of the new confirmed cases has Lagos having 10, the FCT, that's Abuja, having 2, Oyo having 2, Delta and Katsina have 1 each. In the case of Delta and Katsina, this are their first confirmed cases. From there, we go to Oyo, where the governor, Seyi Makinde, has vowed to stop the spread of coronavirus in the state. The governor, who has just tested negative to the virus, made a tour of the newly equipped isolation center in Ibadan. Our correspondent, Bukola Orewo, has more.
Hello, Ladi. Residents of Oyo State woke up to the good news that the governor has tested negative to the coronavirus. He did promise that he will begin work, and true to his words, his first assignment was a visit to the isolation center at the infectious disease center at Oludu, where he saw for himself work being done at that center.
COVID-19, like the experts have been telling me, it's we're all in an uncharted territory. So we may not be 100%, we may not be perfect, but I want you to continue to give us your support, because we're here to work for you, and we're here to ensure that no life is lost to this pandemic. Please continue to follow the directives of the task force. I'm back to work now.
Efforts are underway to ensure that the pandemic, the COVID-19 pandemic in Oyo State, is brought to a halt, or at least damages are minimized. And the governor did promise that he will ensure, by all means necessary, that no life is lost to the pandemic in the state. Bukola Oriowo, Channels Television News.
Thank you, Bukola. And now in the studios, joining me to take a look at some of the issues that have been thrown up by the more recent developments is Dr. Lera Roberts, who is a consultant public health physician. Nice to have you with us.
Nice to have you.
Thank you.
Nice to be here.
Now, I want to start off with something that is fairly grim, and because it affects people like you who are on the front line, and that is that the exposure of health personnel to people who don't tell the absolute truth about their history, both their medical history and their travel history. We've already had a case or 2 of people who it was found out later that when they presented, they didn't provide full, truthful information. How harmful is that?
Extremely harmful. Like the situation we've had in the Lagos University Teaching Hospital, it has pulled vital staff off the front line, who have now had to go into isolation and are going to be offline, literally, for 14 days. And we have to now start tracking their contacts, tracking the contacts of all the people this person had come in contact with. And it's just unnecessary. It's totally unnecessary. I mean, I get that people feel that there's a level of stigmatization, but when life is concerned, it's better to get all the help that you can, as soon as you can. Of course, the situation in the University of Ilorin Teaching Hospital is even more grim, because it's led to the cessation of a man's career, all for a decision. Yes, he's been suspended and may likely not come back to work, but for what? What was the reason for taking that decision that he had to take? It is better to, as he said, there are 2 people you should never lie to. Never lie to your doctor, never lie to your lawyer. Because at the end of the day, your life is at stake.
Indeed. Now, the increasing number of people, of course, from the various reports we see, it appears as if people are increasingly bursting, that's my word, bursting this restriction. Of course, we've got reports of traffic in Lekki, one wonders if all those people in that traffic are essential service personnel, and if so, where they're headed to. And then, of course, in other parts of the country, restrictions are being relaxed in some places, and workers have been asked to resume work, while other places are just imposing their own restrictions as it is. So the question is, the containment efforts, what happens to the containment efforts with this?
It would be tragic if the gains we're making, that we have had or we have made through this 1 week of lockdown, are lost simply because we don't have the stomach and the stamina to go through it to the end. Whether we like it or not, this is a disease that has a 14-day incubation period. That means assuming you don't even know who is carrying the disease or who is likely to test positive on day 1, certainly by day 14, that person is starting to exhibit symptoms. And it gives us that time to be able to track and trace, isolate and treat. And it'll be such a disaster if, having made all this gain that we have made, you know, we now lose it because we don't have the stomach and stamina to last the next week. We don't expect that we will peak until about the weekend, until about the Easter weekend. And we have the lockdown in place technically until Monday, Easter Monday. If we can just hold on, it'll allow us to continue tracking and tracing a lot of the people that we still have interest in. Now, you would have heard yesterday, I believe, or day before, when we started saying that there's been some community transmission.
Indeed.
So what it is that passengers of interest, POIs as we call them, have come in, there's been one contact, then a secondary contact. And those secondary contacts are the ones who have now, of course, unknowingly, would now be spreading the virus if we don't contain them. So what the lockdown has achieved till now, yes, it has not been perfect, but I would still give it a good 80 to 85%. And everybody who knows me as an examiner knows that that is being extremely, very high. Because it has allowed us to at least lock down people within communities and prevent the spread of the virus, because as we say, it's not, the virus doesn't move, no hands, no legs. It is the people that move it. And if we can contain within the communities, then even if there's a contact, a case or a suspected case within a community, we lock down a smaller bunch of people than if it's now traveling recklessly all across the state and across state lines. So you're right. One does wonder, with the offices closed and the banks operating only the back-end administration, how many essential services are moving around in Lekki to the point where there is traffic? And the problem is that, as we're seeing in China and I think in Korea, South Korea, there have been a few blowbacks. There has been another surge. So we would not want, we can't, the thing that we are not good at is case management. Case management is not what we are good at. We are now just beginning to ramp up the isolation centers, and we're only now beginning to get ad hoc volunteer staff that we're training. We do not want to be overwhelmed with cases to manage, while what we are really, really good at, surveillance, contact tracing, and case investigation. That is what we're good at. And another 7 days of a lockdown will allow us to finish as much as we can and make sure we've got this thing contained.
Now, the other thing about this is that it would appear as if with every new confirmed case comes a new list of people to trace and contact and so on.
Absolutely.
Do you see a situation where we may get to a stage where the actual effort or attempt to contact, follow people who have had contact with confirmed cases tends to take more personnel and more time and more effort away from the job of, as you said, case management?
Well, the beauty of it is that we need less specialized staff to do the contact tracing and than we need to do the case management. The case management requires the intensivists, the anesthetists, the nurses, the physiotherapists, and they need to be very specially trained to work within the isolation centers to handle all that fancy equipment that we saw earlier on. But for contact tracing, we can use a lot more ad hoc staff and what we call, task shifting, task sharing. We can use people we need less arduous training, as it were. So there's no mix. There's no mixture of the staff that are needed for the surveillance. And we've been training the teams for surveillance contact tracing. We don't forget, we've been training them since before Ebola.
Indeed.
So we've got teams and teams and teams who are already very, very competent at the surveillance, contact tracing, case investigation. We've got masses of them, but we cannot suddenly, repurpose them to handle case management, which is where and this particular disease requires very intense case management.
Indeed. Of course, we'll stick with Dr. Alera Roberts, but for now, we want to go global, where there are quite a number of things that have happened also today. There's been an increase in the death toll from the COVID-19 pandemic in the United States and some countries in Europe. More than 10,000 people have now died each in France, and indeed a number of other places, even in the US, following an increase of 607 deaths in 24 hours. While 7,091 people died in hospital, more than 3,000 have died in care homes. In the UK, where Prime Minister Boris Johnson remains in good spirits and breathing without assistance, 786 other people have not been so lucky, having died in hospital, raising the death toll to 6,159. And the US state of New York is said to have recorded its highest single-day increase in virus deaths today, 731, raising the total to 5,489. Meanwhile, in China, where it all began, they say they have no new coronavirus deaths.
The Chinese Health Ministry says not only has no death been reported today, there has also been no new domestic case of coronavirus in the country. All of the new confirmed and suspected cases recorded on Monday, which were tallied in the 24 hours from midnight, were from overseas. A government official says that no new cases, however, does not mean zero risk, as there are still a lot of unknowns regarding the coronavirus, including the source of infection and mutation. Japan's Prime Minister Shinzo Abe finally declared a month-long state of emergency in response to the pandemic and unveiled a record stimulus package aimed at steering the world's third-largest economy through its biggest crisis since the war. He told a televised news conference that a recent sharp rise in COVID-19 cases in Tokyo and other urban areas had forced him to rethink the country's approach towards stemming the outbreak. Italy, on the other hand, has approved a new emergency decree that will offer more than 400 billion euros worth of liquidity and bank loans to companies hit by the coronavirus crisis. The legislation would allow banks to offer credit totaling more than 750 billion euros to stave off the collapse of the Eurozone's third-largest economy. More than 16,500 people have died in the country from the pandemic since February, the highest toll of any country. In the meantime, police in Paris, France have changed their tactics into doing checks on foot and using unmarked vehicles as the country enters its fourth week of confinement to fight the coronavirus outbreak.
Ça veut dire quoi?
The country has not yet reached the peak of its COVID-19 pandemic, so says the Health Minister, Oliver Véran, as it is still at a phase where the pandemic is worsening and that the lockdown would last as long as necessary. Also, a number of cities are to distribute face masks as part of the fight against the coronavirus. And while the British Prime Minister remains in hospital a second day and is said to be stable, Cabinet Office Minister Michael Gove is self-isolating as a member of his family is displaying COVID-19 symptoms.
As we speak, the Prime Minister is in intensive care, being looked after by his medical team, receiving the very, very best care from the team at St Thomas's, and our hopes and prayers are with him and with his family.
In the meantime, a further 758 patients diagnosed with coronavirus have died in England, bringing the total number of confirmed hospital deaths in England to 5,655, up from 4,897 at the same time on Monday. Meanwhile, the pace of coronavirus deaths in Spain ticked up slightly for the first time in 5 days today, with 743 people succumbing overnight to reach a total of 13,798. That compared to 637 people who died the previous 24 hours in the nation, with the second highest toll of fatalities in the world from the pandemic. Total cases rose to 140,510 today, from 135,032 cases on Monday.
All right, the global update. Before we go on, just a quick note here that only 16 new cases have been confirmed of COVID-19 by the Nigerian Center for Disease Control. Their website has just reflected a change. They originally posted 17, but that has now been changed to 16 new cases. So for those wondering about the disparity, that is how it happened. 16 cases have now been confirmed by the Nigerian Center for Disease Control. Now we go to the United Kingdom, where we're joined by Dr. Chris Angbo, who's clinical lead, acute kidney injury services at Northwest Anglia NHS Foundation Trust in Cambridgeshire. He's a consultant renal and acute medicine specialist. Thank you very much, Dr. Angbo, for joining us at this time. What can you tell us about the situation generally in the United Kingdom? The numbers are not quite friendly at this point, are they?
Thank you very much. The situation at the moment is quite critical. We've just entered the peak phase. We have about 6,000 deaths, above 6,000 deaths confirmed as of today, and the daily rise is going up above 700. However, the number of cases getting newly infected has plateaued, so we're entering the crisis period, which is this week and next week. And I think from the National Health Services, we are well prepared for this. We have built a capacity within most NHS hospitals, and we are reducing the routine operations cancelled. All the visual clinics have been cancelled. So what we are trying to do is to increase the capacity within every hospital in the NHS so that we can have enough capacity to contain these patients coming in with the coronavirus. Regarding those ones that have been confirmed to have that, we do have cases where those ones that are just mild symptoms, they can go home and self-isolate for 7 days, and members of the family will self-isolate for 14 days. We expect that those people will recover. However, if for any reason within that 7 days they get worse, they come back to the hospital and we reassess them. Some are admitted into any of the COVID receiving wards in the acute hospital setting. Some, of course, receive treatment and they do not need to go into ITU. A smaller proportion of patients might deteriorate and requiring intensive care treatment, either having ventilation or non-invasive ventilation. So those are the cross-section of patients we're having at the moment. We are very prepared. Things are getting on very well. At the moment, we're kind of plateaued in terms of the treatment we are giving onto our patients. Last week, in the whole of NHS, we've started the treatment for clinical trial for the treatment, which any patient confirmed with COVID-19 virus is put into a specific arm of the treatment. So we're hoping that in the next 2 to 4 weeks, we should be able to get good outcome in terms of the number of patients that are responding to the treatment. Overall, I think things are under control.
Dr. Angbo, I'm sorry to interrupt. We'll have to take a short break at this time. Please hold those thoughts because when we return from break, I'll allow you to finish the thought, and then I'll allow you also assess the Nigerian situation from a global perspective. Please stay on with us. Thanks for staying tuned. Welcome back. And we're still with Dr. Chris Angbo, who is at the Northwest Anglia NHS Foundation Trust in Cambridgeshire in the United Kingdom. Dr. Angbo, before we went on the break, you were talking about the situation with case management, but I want to use the little time that we have left for this discussion for you to talk from the outside looking in. From what you've heard about how we're doing in Nigeria, what's your assessment?
Firstly, I want to appreciate all the healthcare workers in Nigeria for all the great job they are doing. And it's quite a very crucial period, and what they're doing so far, I think, is quite brilliant, and they should just carry on with the hard work they're doing, and the sacrifices will be worth it. And in terms of the early lockdown and all that, that is very good, because what is happening is that the main thing is to actually stop the spread of the virus. And once we're able to do that, we can actually minimize or reduce the impact it has on the facility. So I think having an early lockdown is very, very, very good. Doing it at this time, and it will also help to slow down the spread of the virus in Nigeria. And for the general public, I want to tell you that COVID-19 is real. It's not a fake news. So please take it very seriously. If you are told to stay at home, do stay at home. Your staying at home can actually help save lives and protect the facility that is available. So I think it's very important that the public understand the implication of what is going on. It might look a bit difficult, people having to be locked down to stay at home for a period of time. In the UK, we're already on the third week, and we can see the pattern of the reduction in the spread. So I think it's very important that people understand the importance of what the government is trying to do by telling them to stay at home, social distancing, good hand hygiene, eating well, exercising. All these are going to reduce the number of people coming down with coronavirus. That will also reduce the impact it will have on the health facility if we get to the crisis period. I think overall, the healthcare team are doing excellently well in Nigeria, and they have to keep up what they are doing. And for the public, they have to really, really comply with all the restrictions. I know it's a difficult time. We're all going to get through this, but we need to work together, make sure that everything that you are being told to do, you do that. And one thing I want to tell the general public is, please be mindful of social media information overload. A lot of messages are being sent out on social media, left, right, and center, unverified false messages. Please be careful of that, because that instills fear into people. We don't need to panic. We can control the situation, remain calm. If you have the symptoms, contact the necessary authority, and your symptoms will probably be dealt with. So those are the early things we need to do.
Dr. Chris, I'm going to completely run out of time. Thank you very much for your time. I'm sure those who are listening, of course, will hear you. Thank you so much for joining us at this time.
Thank you very much. Stay safe. God bless.
Thank you. Thank you very much. Now, Dr. Roberts, we've got just 1 minute. Your final thoughts.
Stay home. Let us curtail the spread of this virus. Let us not spread this virus. We have to contain it where it is now. What we're good at, we're doing very well at. But what we cannot do, we know we cannot do. And we don't need anybody else to be victims. So please stay home, stay safe, stay alive.
That's the message, and that's a very good place to leave it. Let me thank you, Dr. Roberts, as usual, for being with us. It's a lovely...
Don't worry, we'll get through this.
Thank you very much.
Thank you very much.
And that's how we're going to wrap it up on our COVID-19 special tonight. My name is Ladi Akere-Dolale. As always, would love to hear from you. Of course, the social media handles to which you can send us what you're doing while you're at home, if you're working from home, or what you're doing to while away the boredom and all of that. Please would like to hear from you. But for now, it's enough time to say good night.